This video will demonstrate sampling techniques for skin-sparing mastectomy specimens. Be sure to be familiar with the most current AJCC guidelines on the CAP website before sampling any specimen. As you can see here, based on the most recent AJCC guidelines, the staging is based on tumor size and extent of invasion, including extension to the chest wall, invasion to the pectoralis muscle, ulceration of the skin, the presence of macroscopic satellite nodules, and/or findings consistent with inflammatory carcinoma. Be sure to pay close attention to these parameters during gross examination and sampling. Here is the final gross description for the specimen you are about to watch. It is here for your reference, and it will be shown again at the end of the video. Here we have a skin-sparing mastectomy specimen consisting of breast tissue, skin, and nipple. Note the laterality of the mastectomy, i.e. right versus left. Many specimens will show an axillary tail, which appears as an extension of fatty tissue at the lateral aspect of the specimen, which may be designated by the surgeon with a stitch. In this case, the axillary tail is not prominent, so we rely on the surgeon's designation of the specimen as right breast in this case. In this specimen, there is a stitch marking the 12 o'clock position, which allows for orientation. Begin by weighing the specimen. Next, measure the specimen in 3 dimensions: medial to lateral, superior to inferior, and anterior to posterior, as shown here. Also measure and describe both the skin ellipse and nipple areolar complex. Note any skin or nipple discoloration or thickening. Carefully document the orientation of the specimen by using 3 different ink colors. Deep/posterior is inked black, anterior and inferior is inked green like the grass, and anterior and superior is inked blue like the sky. Make sure to use vinegar to fix the ink to the tissue. Using an adequately large and sharp blade, thinly section the mastectomy specimen through the deep/posterior aspect as shown here, approximately 0.3 to 0.4 centimeter thick sections. Examine the cut surface of each slice to look for masses or lesions. It is important to always be familiar with the patient's history before taking sections for histology. This includes looking at all imaging reports and prior pathology reports, such as biopsies. With this information, you will know the size and location of all potential lesions to be sampled, as well as the presence of any biopsy clips. Use the Faxitron X-ray device to locate any difficult-to-find biopsy clips. In this case, there were 2 lesions associated with biopsy clips and 2 lesions without clips. For each lesion with biopsy clip, identify the clip, measure the biopsy site cavity, and describe the associated lesion, including size in 3 dimensions and distance to the closest anterior and posterior margins. For lesions without biopsy clips, measure the size and distance to margins. In cases with multiple lesions, document relationships by measuring distances between lesions, and make sure to sample breast tissue between lesions to characterize extent of disease. In neoadjuvant cases, the lesion may be difficult to identify grossly. In these cases, measure in 3 dimensions large fibrous areas that may represent tumor bed and sample from these areas. Once all lesions are identified, you can begin submitting sections for histology. Submit 1 section of skin and 1 section of nipple. Trim the tissue as needed to make it an appropriate size for the cassette. Submit 2 to 4 sections of each lesion and representative sections of the margins closest to each lesion. For any 2 lesions, submit 1 section of breast tissue between these lesions. Submit 1 representative section from each quadrant of the breast and 1 from the central area of the breast. Remember to palpate the axillary tail and submit any possible lymph nodes. Remember to remove all biopsy clips from the tissue before submitting to histology. Here again is the final gross description for this specimen. You can see we submitted representative skin and nipple, all 4 lesions with margins, areas between the lesions, and random representative quadrants and central breast tissue.